All right, guys. Today we are looking at the Renin Angiotensin Aldosterone system. Yesterday we started with the cardiac pharmacology, and today we are continuing with it. We did alpha adrenergic receptor blockers. We did beta adrenergic receptor blockers, and today we are here, the Renin Angiotensin Aldosterone system. It is going to be a story. First of all, I'm going to narrate the story fully. Then, second, I will slow the story down. I will break it into parts, and I will call people who wish to memorize it to try it. And then, as they try it, one, two, one, two, one, two, about three people trying a particular step, we move forward to the next step. And I'm promising you, you may not even need to pick a book. It will just sink hook, line, sinker for you, and you'll be fine. Okay, you'll be fine. So this is the story. There are natural mechanisms in the body that will help you bring your blood pressure up if your blood pressure is low. And there are others that will also bring your blood pressure down when your blood pressure is up. These natural mechanisms are just ways the body kind of adapt or maintain homeostasis, a constant internal environment. So when we take the renal system, we call something the renal fraction of all the blood that will pass through the body. Some will also pass through the renal system. Renal nechefa, the fraction that gets to the renal system. So the renal system is quite familiar with the way blood come to it. Every day blood pass through it. It is filtered, glomerular filtration, tubular reabsorption, secretion. Then you are having your urine. So every now and then blood passes there. So trust you me, the kidney is equipped to understand. If the pressure of your blood coming is low, they will know. If it is high, they will know. Because even by gravity, everything is pouring down. So the blood that comes to it, he knows. Now, when the kidney senses that your blood pressure is low, it releases a hormone called renin into the bloodstream. Now, renin will roam around in circulation looking for an inactive protein. The name of that inactive protein is angiotensinogen. I will teach you that as time goes on and I'm slowing it down, you understand that when a protein is active, it has a way we write it. And if it is not active, we add something to it. No gen. No, like I normally say no generation, even though it's not like that, but I mean just to help me. So when I see angiotensinogen, I know that it's an inactive form. So angiotensin will be an active form. When I say plasminogen, I know it's inactive. Plasmin will be an active. Pepsin is an active form, whereas pepsinogen is an inactive form. So those are tricks to learn some of these things. And the moment you know that they are in no gen, they definitely need something to make them active. So let's see, let's go on. Now, when renin roams around in circulation, it is looking for an inactive protein called angiotensinogen, sometimes found around the liver, the lungs area, and convert this angiotensinogen to angiotensin 1. Angiotensin 1 does nothing actually in the body. We don't really know the work of angiotensin 1, but we know specifically the work of angiotensin 2. When you go to Ghana, there is a clan, there is a group of people called the Akans. They have a king, and then the name is Otumfuo the second. That is the name of the stool. So you even have your name assigned you by birth, but when you arise onto the stool, you pick that stool name in addition to whatever name you have. And currently the name is Otumfuo the second. Otumfuo is like somebody who is gracious, almighty, whatever. I don't know the exact English, but a title seeking for honesty, for such, not honesty, like somebody who is powerful kind of thing. Uh-huh. And so Otumfuo the second is what most people know that Akan leader to be. But we don't really know much about Otumfuo the first. It is almost synonymous to what I'm trying to explain here. We know what angiotensin 2 can do. And what we know him to do is that he's a potent vasoconstrictor. What he does is that when your vessels are open, he will constrict them. And his presence alone, the presence of angiotensin 2 alone, will cause your adrenal gland to also release a hormone called aldosterone from the adrenal glands. And this aldosterone, what it does is that it makes sure that sodium is reabsorbed into the body. Sodium, wherever sodium goes, water will go. So water too will be reabsorbed into the body, and potassium will be excreted. This is the overview. This is the bird's eye story of the whole angiotensin aldosterone system. However, we are going to take it slowly and we are going to learn. I need somebody to just tell me his name or her name that he is here, and then I'll do it with you.
Sir, I'm here. Mabel.
Mabel. All right, Mabel. Nice to hear from you, Mabel. Did you understand the other thing we did this morning?
Yeah. Thank you.
You're welcome. Now, Mabel, what is happening is that when the blood pressure is low, the kidney senses it and then release a hormone called renin into the bloodstream. What did I just say?
You said when the blood pressure is low, the kidney senses it and then it will release renin into the bloodstream.
Okay. Now, the whole thing that is going on is that the blood pressure is low. So the kidney is on a pursuit to make sure that the blood pressure goes up. The kidney understands that cardiac output plus systemic volume, one resistance. The kidney knows it. So it's on a journey. So when the blood pressure is low, the kidney or the renal system, anyhow anybody wants to put it, senses it and then releases renin into the bloodstream. Now we are continuing the story. What happens is that renin roams around in circulation, finds an inactive protein. Now, if you are able to recall the inactive protein and tell me right now, I'll say 3 points. I'll just say I'll give you 3 points. I hardly give marks. So renin will roam around in circulation and find an inactive protein called angiotensinogen and then convert it to angiotensin 1. Okay, now in fact, angio actually means vessel. So when you hear words like angio, thromboangioobliterans, what we call the beggar's disease, it has got to do with vessels. Angio actually means vessels. Yeah, but tension has got to do with pressure, that kind of thing too. But over here, we are just using the name as ascribed to a protein. I intentionally give you the information you need, then I boot around the bush to make sure that the information tries to vanish from your head. Then I push it back as a method of teaching. Okay, it's a trick. It's purposeful. So what I started doing with you was that I first of all told you that when the blood pressure is low, the kidney senses it and then release a hormone called renin into the bloodstream. This renin will be roaming around in circulation, looking for an inactive protein called angiotensinogen and convert it to angiotensin 1. Can you narrate it so far?
Okay, so you said when the blood pressure is low, the kidney senses it and then it releases renin. And then renin roams in a circular motion, kind of. And then it releases angiotensinogen. And that angiotensinogen will be converted into angiotensin 1.
Okay, listen carefully to the other side. It is not moving in a circular motion and it is not releasing anything. Angiotensinogen is already in your body. It's a protein, just that it is not active. So what renin is doing, that it is roaming around, though, not just in circular motion per se, but moving through the body, searching for angiotensin wherever it will find it. But mostly it finds it around the lungs or the liver. Okay. So when it finds it, then the renin will act on that angiotensinogen. And when it acts on it, it converts it to angiotensin 1. You see the trick now?
Okay.
Yes, so now you have to tell me that when the blood pressure is low, the kidney senses it, sends renin into the system, and then renin will roam around or will search for an inactive protein called angiotensinogen and convert it to angiotensin 1. So here you go, Eva.
Okay, so when the blood pressure is low, the kidney senses it and then releases renin. And renin roams around in the body looking for angiotensinogen. and it acts on the angiotensinogen to now release angiotensin 1. Convert it to angiotensin 1.
Yes, so it's not going to release. That thing now will convert. Okay. Let me call somebody else to also try. Somebody should just try quickly to where we are.
All right, Sabi.
Yes, try it.
Oh. Yes, so you made us to be aware that when the blood pressure is low, the kidney senses it and
it's low, right?
Yes.
I thought I had slow motion.
Oh no, it's low. When it's
okay, slow. Okay, right.
Or when the blood pressure goes down.
Good.
Way. Yeah, the kidney senses it. And
before you continue, I just want to also kind of encourage you. The other time I saw you were very active on the question banks when the group was doing it. Good job. Keep it up.
Thank you.
Yeah.
Thank you.
Start afresh. Start afresh.
So he said when the blood pressure is low, the kidney senses it. And there's this hormone called renin. No, renin, it's released when the blood pressure is low. Renin is released
by who?
In the bloodstream.
And who does the releasing? Who does the sensing that the blood is low, and who releases it?
The kidney senses it. Yes. Good. So when it senses it, it releases renin. Then renin in the blood looks for an inactive protein called angiotensinogen.
Good.
Then convert it into angiotensin 1. Thank you.
No. Thank you. I mean, that was so simple and easy. The last person, yes.
Okay, so hello.
Okay. Yeah.
Can I hear the male voice, please?
Okay.
Okay, so when the kidney senses that the blood pressure is low, the kidney releases renin. And renin looks for angiotensinogen, which could be found in the lungs of the liver, and then converts the angiotensin to angiotensin 1, which
that's all. Don't go further. It's okay. Caleb, you know you will kill us. Well done. You made it simple. There was another beautiful lady who wanted to speak before you. There was a beautiful lady.
Okay, hello, Asabi.
Yeah.
Okay, you said that when the blood pressure is low, the kidney senses it and then releases renin. So the renin will be in the blood stream, and then we will look for the inactive form of the
inactive form of the angiotensin 1, which is angiotensinogen, right?
No. Yes.
No, I don't know. I mean, come on for this. I know.
It will look for the inactive form of the angiotensin 1. That is the angiotensinogen, okay? And then the angiotensinogen will, in the presence of the renin, will help it to convert it into angiotensin 1.
And those are would different how they're based on different because I've done to master to done to master. Oh man, the Patricia one can be a new.
Asabi.
Yes, sister Pat.
Okay. Please, when the blood pressure is low, the kidney senses it and then release a hormone called renin into the bloodstream. Renin will now look for an inactive protein called angiotensinogen.
Good.
And it
3
will
points.
act on it to convert it to angiotensin 1.
Angiotensin 1. Beautiful. Well done, guys. Now we are continuing the story. You know, it is actually angiotensin 2 that we want. So at this point, when we are continuing the story, you will say that angiotensin 1, you see, so the story will end like when you started from when the blood pressure is low, the kidney senses it and then releases running into the bloodstream, which says for an inactive protein called angiotensinogen, converts it to angiotensin 1. Then you start from angiotensin 1. One for brofuni ya. Akwakofa Betty Brof no nti best preni mo hwe Betty jai ono we good nti aka be hu ngobi anka no kyerɛ be kyerɛ no. So you stand on that utensil 1 and build on. angiotensin 1 is now, listen to the English too, is now acted upon by an enzyme and converted to angiotensin 2. But guys, listen, the name of that enzyme, we don't really know. There are so many enzymes that I know in the human body. I can mention a lot of them for you. But then there is this particular one, we don't know the name. So what we can do best as anatomists, if there are people like that, or physiologists, is that we will rather name this organism by what it does. We will call it the angiotensin converting enzyme because it is the one that converts angiotensin 1 to angiotensin 2. So when I said the story from the renin being released into the system converting angiotensinogen to angiotensin 1, I say angiotensin 1 is further acted upon by angiotensin converting enzyme, converting it to angiotensin 2. Or you can say angiotensin 1 is converted to angiotensin 2 by ACE or by angiotensin converting enzyme. Mabel, over to you. Joe Latte. Start from the top. Will be possible.
Okay, so you said the angiotensin 1 is being acted upon by an enzyme called angiotensin converting enzyme, which will convert it to angiotensin 2.
Media started first, so the fabric angiotensin 2, angiotensin 2.
Okay, so we are starting from the beginning.
Okay.
So if the blood pressure is low, the kidney senses it and releases renin.
Good.
Renin will now look for inactive protein.
Inactive protein, 3 points, straightforward. Who compare 3 points?
Which is angiotensinogen. And it will act on it and convert angiotensinogen to angiotensin 1.
Yeah.
Now, this angiotensin 1 also is being acted upon by angiotensin converting enzyme.
Yeah.
Convert to angiotensin 2.
And converting it to angiotensin 2, right? You do all. Mavis, they say it's because it was on the screen. Please prove me wrong.
Oh, no. I wasn't.
Okay. Let's see.
Okay.
Let's go.
Okay, so when the blood pressure is low, the kidney senses it and releases renin into the bloodstream.
Well done.
And renin will look for inactive protein called angiotensinogen, and it acts upon it to convert the angiotensinogen to angiotensin 1. And the angiotensin 1 will also be acted upon by an angiotensin converting enzyme to convert it into angiotensin 2.
Hello, we good Dr. Bijina when our rat was because hey, you what were you now? Dr. Babu sounds now. Voice and also very nice. So say Bianca, how they can news and now can Bible near Ibisa very calm and nice. We use a modern Sunday may yard in this idea. Voice very calm. Nice. Yeah. Me Pacho, do I have another person trying it to angiotensin 2? Just rattle it through quickly.
Yeah, Asabe. Good.
Let's
Okay,
go,
then let me take it. It says when blood pressure is low, the kidney senses it and releases renin into the bloodstream, which then also looks for an inactive protein called angiotensinogen, and convert it into angiotensin 1. Then the angiotensin 1 will also be further converted by angiotensin converting enzyme into angiotensin 2.
Hey, what? Where you find abokobi? Already. Hey, what do you know?
Nkrofo crew, awokobi wa.
Abokobi. Kumasi for no. BBC kakre omutimi generate. You know neologism, eh? Like, Charlie, I can't edible no. Just say there is nowhere like that too, but they create it. Same Kurubo Saraka. Okay, so guys, basically we are at the angiotensin 2. What I would want another person to try and add to the whole story whilst we continue is that the person will narrate it as Anita quickly ran through, but then when the person gets to angiotensin 2, he will add that, which is a potent vasoconstrictor, which is a potent vasoconstrictor. So the next person should try it, and then when it gets to angiotensin 2, you will add that, which is a potent vasoconstrictor. Let's go.
Hello.
Hi, and welcome to MTN. Your call is important to us. For English, press 1.
Thank you.
On the corner. Quincy, we use a headphone and as a watch on where free we are sim and our ball brass and your CPBR.
Patrol W. Please, is it better?
Better, median Kaya, but I don't know for the others if they are hearing you well. Please, guys, are we okay with the tone? Is it okay?
It's a bit far. Her voice seems far.
Okay, then please, somebody should.
Che, Debbie,
I will want to try and see.
Epemeba, Quincy. Won't jay. Mod Macohun anymore, no fair. Me pesa betting no. Can be a fast one me at one and me enter one. Who be my way, please.
I don't know. I'm using a laptop, but I don't know.
So you are speaking
better now.
Directly into the laptop now?
Yes.
A laptop?
Yes.
No headphone, straight into the laptop?
Yes.
Okay, go ahead and talk. We will force and hear you.
Okay, so when the blood pressure is low, the kidney senses it and releases renin, which converts angiotensin into angiotensin 1. And then it is further,
which converts angiotensinogen, right?
Yes.
Okay.
The renin, the angiotensin.
Machada, I disturbed you. I know it's for a reason. So gather it all together and come again. I trust you can still do it. You know it. Just that the framing pressure number that also in account. It's all part of the training. So start afresh. Let's go.
Okay, so when the blood pressure is low,
good,
the kidney senses it and then releases renin, which converts angiotensin into angiotensinogen 1.
So word, which converts angiotensin. Angiotensin is active form of that word. Into you also work out the inactive form of that word before it can be converted to an active form. So you have to add
okay, so angiotensinogen.
Good.
Into angiotensin 1.
Beautiful.
And then it is further acted on by an enzyme called ACE.
That is the angiotensin 1. The angiotensin 1 is acted upon by an angiotensin converting enzyme, which you call the ACE, right?
Yes.
And then convert the angiotensin 1 to what?
Angiotensin 2.
Which is what? The angiotensin 2 is what? A potent vasoconstrictor.
A potent vasoconstrictor.
Well done. Well done. Mesa fro emeripem na kwa me do be faso no ubenu ho kra se oba ha awie. Enya ye beda callers for na se na yakọ ye next caller so o voice na te se obi a wa frɛ radio so me na me ka kyerɛ wo so man ka uti etie o tone na te se obi a ye ayi mpaso nkomo anajo 9 pm na wa frɛ e ka se woni ne kunu na da ho sisia na opese obusa ehun tricks sana voice na sound what patient sister Epe, thank you Quincy. Epe, let's go.
Okay, so when the blood pressure is low, the kidney senses it and then release renin. The renin will go around looking for an inactive protein,
good,
which is called angiotensinogen, and then convert it to angiotensin 1. So now the angiotensin 1 will be acted upon by an enzyme, right? So
what is the name of the enzyme?
The enzyme is angiotensin 2.
The enzyme is angiotensin converting enzyme.
Yeah, angiotensin converting enzyme.
Good.
Which is a potent vasoconstrictor, right?
Sorry for interrupting you. You were flowing fine until I distorted your thought.
That's okay.
So it was like when you got to the angiotensin 1, which was like you use renin to convert angiotensinogen to angiotensin 1, you were continuing. But
okay, so let me start from there.
Yes, okay.
So when the angiotensinogen will be now converted to angiotensin 1, so now the angiotensin 1 that is already converted will be acted upon by an enzyme. And which will also convert it to angiotensin 2.
Which is what?
Which is a potent vasoconstrictor.
Which is a potent vasoconstrictor, ladies and gentlemen. We in calculate centaquinans. 3 points, correct for 3 points. Which is a potent vasoconstrictor. The only fight, the bone of contention I have to pick with you, my dear, is that you are talking like the old scientists who decided not to name the organism, say by an enzyme. What is the name of that enzyme? Angiotensin converting enzyme, ACE, right? That is the name of the enzyme. So normally when you get there, you can, but what you narrated is perfectly fine. It does the trick for you and it's okay. There is nothing wrong in that. All right, we are going to continue the issue. Now, Maud, your question. If it is a potent vasoconstrictor, what does it mean?
It means that it will act on the blood vessels and constrict them.
When the blood vessels gets constricted, what will happen in the body?
The BP will be raised.
The BP will be raised. So it means the heart will have to work harder, right, to push things through it. Why is this all happening? Because
there is a decrease in blood flow to the kidney. So the blood, the heart is trying, or the body is trying to compensate for that hypoperfusion.
Excellent. Exactly my thought. Thought way important. Okay, all right, that's a beautiful one. But here's the thing. Those of you whom I introduced the king, for the second to you, I grew up in Sante region, so he was my king. I mean, he is my king, but now that I'm relocating to the States and when I take my citizenship, I don't know whether I still have kings or not. Because I'm no more following a monarchy. I'm in a democratic world. That is just by the way. Please, I'm still a member. The concept is, I didn't really know the necessity of these kings and monarchies in this 20th century or 21st or 22nd century. I don't know which century we are in. But I learned that he has a scholarship and a foundation that seeks to help the poor, people who are less privileged. He even uses his kind of aura or position to advocate for welfare. Not so long ago, a queen in England died, and this king was honored to be invited. He was picked up by a jet to also attend the funeral. Now, a person going to a funeral, he came back with a whole good fortunes. He brought was it £1 million or so, and he deposited some into the Ghana Scholarship Secretariat to help with students who are on scholarship, deposited some to get fund and other funds that seeks the welfare of people. So obviously, I don't know about Otum for the first, but Otum for the second, I can say is very potent in his display of majesty. He's really helpful and working. So by virtue of all that he does, and then even with the way I've narrated him to you, when he walks through your town and then I say, hey, the king is going, believe you me, people would like to see him just to, see whoever Asabi is hyping that much. Just like that, the presence of angiotensin 2 in the system also causes something to happen, and that is the adrenal gland. In fact, all that is happening today is with the renal system. It's happening in the kidneys. But there is something attached to the kidneys, which is the renal. Somebody says something that helps the kidney, something that is part of the kidney, something that is seeking refuge for the kidney, something that wants to prove a point to the kidneys. So when they saw that the kidney, with the release of renin, acting on angiotensinogen to convert it to angiotensin 1, and then angiotensin 1 further being acted upon by an angiotensin converting enzyme to angiotensin 2, and now this angiotensin 2 is in the system constricting vessels, the adrenal gland will also like to help. And this is how they're going to help. So we are going to continue the story with how the adrenal glands will also respond in the presence of angiotensin 2. What is going to happen is that the presence of angiotensin 2 is going to cause the adrenal gland to release aldosterone. Aldosterone is going to cause sodium and water retention in the body. Now, my question will go back after everything. My question will go back to Maud, and I will ask her, Maud, why do you think, or what do you think will happen to the body if we have too much of fluid in the body? What will happen? Then Maud will say what?
Too much of fluid, then this whole process would not work.
When we have too much of fluid with respect to the heart, so now why are you busy?
When we have too much fluid with respect to the heart, then the heart will not allow this conversion, the angiotensinogen thing, so that we can
So that's another view. But what I wanted you to say is that when there is fluid in the body to cause the heart to work harder, right?
Okay. Yes, sir.
Yes, and that will increase the pressure. I'm picking on you unawares. Okay. So where we are going to continue, maybe are you still there?
Yes, I am here.
Okay. What we are going to continue is that you say the presence of angiotensin 2 stimulate, you use the word stimulate, stimulate the adrenal gland to release aldosterone. Then the aldosterone will cause sodium and water retention. Now, you see, aldosterone is like, there is a nickname, aldoster, then ONE1, aldosterone. So when you add it together, it sounds aldosterone. Aldosterone is a soldier. Aldosterone is a nickname of a soldier. So ever since I said aldosterone is the name of a soldier, each time I see aldosterone, I know that it causes sodium retention. That's why I said it's a soldier. It helps me recall. Now, Mavis, have you heard that wherever sodium will go,
water moves?
You've heard that before, right?
Yeah.
So if you are retaining sodium in the body, it means water is retaining. That's why when a person has hypertension, they say, please reduce your salt intake. Because if you are putting too much salt in your body, you see, the people that I spoke about, the accounts, they call hypertension mojamroso, literally meaning too much of fluid in your body. They think when your fluids increase in your body, your heart will have to pump harder or use more pressure to pump it, which is actually true anyway. It's true. So, yes, when sodium and water is retained, it will increase your blood pressure. So, you will start again and say angiotensin 2. The presence of angiotensin 2 stimulates the adrenal gland to produce aldosterone. Aldosterone will cause the reabsorption of sodium and water. I'll add the potassium later. So try it. Let me see.
Okay, so with the presence of the angiotensin 2, it will stimulate the adrenal gland, which will release aldosterone. And aldosterone will cause absorption of sodium and water.
Okay, well done. Another person should also try.
Yeah. So you said the angiotensin 2, which is a potent vasoconstrictor, will cause the release of aldosterone from the adrenal glands, which then causes retention of sodium and then water.
For you, I will let you add and then excrete potassium too.
And all right, okay. So that it excretes potassium.
I will explain later. But I want you to start from the top. And I'll give you good news today too. I feel it in my body.
So you said from the beginning, when the BP goes down, the kidney senses it. And when it does, it senses it, it releases renin into the bloodstream. We then look for an inactive protein called the Angiotensinogen, which is then converted into angiotensin 1. And then it's also further acted upon by angiotensin 1, like it's further converted into angiotensin 2 by the angiotensin converting enzymes, which is a potent vasoconstrictor. And this then causes the kidney or the adrenal glands to release aldosterone, which at the end causes sodium and water to be retained.
Add the thing I asked you to add.
And also excrete potassium.
Well done. I'm really pleased with you. You're welcome. There is good news on your behalf, watching.
Thank you.
It's a done deal.
Thank you. Thank you.
Another person should try it.
So can I try?
Wait, Abi, you say you be man.
Okay,
now. You see, there was a time there was this Nigerian musician who collaborated with the Ghanaian. Then at some part of the sound, you say, and you me, Madam Fubi, Ewo Igbo, or non so better Nigeria Kasem. Now.
Yeah, sure.
All right, my dear brother Caleb, let's try it just to confuse you.
Yeah. Okay, so when the kidney senses that the blood pressure is low, it releases the enzyme renin, and then renin acts on an inactive protein, which is the angiotensinogen, and then the angiotensinogen is then converted to angiotensin 1. Angiotensin 1 is acted upon by the angiotensin converting enzyme and then converts it to angiotensin 2, which is a potent vasoconstrictor. Now, it also stimulates the release of aldosterone from the adrenal glands, which retains sodium while excreting potassium.
Whilst excreting. Oga, this one that Dove had to give you, that was an excellent one. Well done. Any person who wants to try so that I even take it from the screen, you were trying it without anything. He didn't look on the screen. I could tell everything he was saying was literally his words. I felt it. Any other person to try it? Oh, be confident a little bit. It will help you. Sister Pat.
Yes.
I have Patient and I have Patricia. Can the two of you collaborate and then describe the story to us?
Okay, I'll try.
Okay.
Okay, so where should I start? From the beginning?
Anywhere the two of you. Imagine you are gossiping with Sister Patricia and Sister Patience are gossiping. Where would you guys prefer to start from?
Okay. So let me start from the beginning then.
Okay.
So when the blood pressure is low, the kidney senses it and then release renin. So the renin will go around looking for an inactive protein, which is angiotensinogen. and will convert it to angiotensin 1. So when the angiotensin 1 will be acted upon by an enzyme, which will convert it to angiotensin 1. You said that is a potent vasoconstrictor.
You said 1 instead of 2.
Oh,
Yes.
Well, friend,
it's
no,
actually
count,
2.
Your friend should be coming in, you know.
Okay, my friend.
Like when you say and you miss something, she's supposed to kind of say,
Come
hey,
in and yeah.
I'm to say no.
So Patricia.
Okay. So the angiotensin 1 is then added upon to become angiotensin 2.
By who? You think say what?
By enzyme called the
Converting enzyme.
enzyme.
Good. I like the collaboration. What else?
So the angiotensin 2 now causes the release of aldosterone from the adrenal glands, which retains sodium and water whilst excreting potassium.
Good. Patient, she left something out. What else?
I don't know which one she left out. So the presence of the angiotensin 2 stimulates adrenal glands.
She said all that.
She said that.
What is the character of the angiotensin 2 itself?
It's a potent vasoconstrictor.
Yes, it's a potent vasoconstrictor. Is it a constrictor? Did he borrow the newspaper? He borrowed the newspaper. Did he check the newspaper? He borrowed the newspapers. Okay, all right. Now, guys, here's the story. All this is working together to actually make sure the blood pressure is up. So we are going over again. We are saying that when the kidney senses that your blood pressure is low, it sends renin into the system. It finds an inactive protein called angiotensinogen. I was saying it is found maybe in the liver or maybe the lungs. So let's say the liver. It acts on it and then it converts it to angiotensin 1. Angiotensin 1 is also acted upon by an angiotensin converting enzyme, which is, look at this diagram. It tells us that they are mostly found around the lungs, but we are not worried, you know? I mean, we are learning. So angiotensin converting enzyme acts on angiotensin 1 and converts it to angiotensin 2. Now, this angiotensin 2, we are saying by itself is a potent vasoconstrictor, meaning when it comes, our vessels will be constricted. It also stimulates the release of aldosterone from the adrenal gland, and this will cause sodium and water retention and then the excretion of potassium out of the body. The reason for the excretion is that sodium and potassium are cations. When we say cation, it means they are positively charged. Every electrolyte that is on the atomic configuration table, so science for that scientific periodic table, when they find themselves in their body, they have two things to do. Either they become positively charged or negatively charged. They cannot exist in our body without a charge. So we give them options. Now, these options teach us lessons in life. When they want to be positive, they donate electrons. When they want to be negative in our bodies, they rather gain electrons from us. How funny it is. And this is how life should be for you. If you want to be positively charged, give out.
Give more.
Give more. That is the principle of life. And then you'll be positively charged. So this positiveness, if you look at sodium and potassium, they're in a very congruent, very peaceful, harmonized agreement. Said that when sodium is staying in the system, potassium would like to take the exits just so that we don't have too many cations. And then when potassium is also staying, sodium will do just the opposite. In our story, sodium and water is being retained. Aldosterone I says aldosterone is a soldier, so it reminds you sodium is the one that's going to be retained. And that is going to also add fluid to it because wherever sodium is, fluid will go there. Sodium, by definition, creates a concentration gradient. The body does not want you to have one particular chemical concentrated at one part. What the body can do for you is through an active movement called osmosis, through a semi-permeable membrane, we'll use water to go and kind of should I use the word diffuse or neutralize it or dilute whatever concentrated thing is there? So the more you are storing sodium, water will also go there in attempt to dilute it. So whatever sodium goes, water will go. That's where we get the analogy from. And too much of fluid in your body means your heart has work to do. He has to pump a lot of it in the whole show. So this is the whole story of the renin angiotensin aldosterone system. My question to you guys is that this natural system works when the person's blood pressure is low and the body wants it to be up. Imagine somebody with primary hypertension. Guys, when I say primary hypertension, what do you know about primary hypertension?
Genetic, family history.
Okay, those could contribute. When we say essential hypertension, what are we talking about?
Same.
Same, but it also means that the cause is unknown. So primary, the cause is unknown. Essential, the cause is unknown. What about idiopathic?
It's a disease or something that is causing it. There is no cause.
Unknown origin.
Unknown cause.
Yes, unknown. Idiopathic means unknown. So the rest with the known ones will be the secondary causes, okay?
Okay.
Yeah, so in this case, let's say a patient is having an idiopathic hypertension or essential hypertension or a primary hypertension. We don't even know. Then by grace, is doing some exercises and other stuff, and the blood pressure is coming low. The kidney senses it. What will happen eventually?
It will retain sodium and water to increase the BP.
The blood pressure. It will go through the whole renin, angiotensin, aldosterone system to bring it up. But we don't want that to happen. So my question to you guys is, how do we stop it? How can we stop this process from going on?
By stopping whatever causes the retention of sodium and
whatever causing
angiotensin cycle. No, you need to stop
whatever causes. So we need to stop aldosterone.
No, the angiotensin, the potent vasoconstrictor.
So we need to stop this one.
Yes. No, I think.
I would like to listen to Caleb. Caleb, whatever you say, I will do. After God created the world, he brought animals to see what Adam will call it. The other time when I was reading the Bible and I saw that, was it like God knew the names already and wanted to test Adam, or genuinely didn't have a name for them and wanted Adam to name it? And then at the end of the script, it says that whatever Adam called the animals, that was its name. Does that mean that Adam was able to get a name that was already in heaven, or God simply accepted what Adam named them? Charlie English and Okay, all right. So Caleb, tell me, we want us to be bold. Just say it. I feel it in your heart.
Yeah. Since this processes are able to cause increase blood pressure by their natural processes. So we've known that Angiotensinogen, Angiotensin 2, is a potent vasoconstrictor, and aldosterone also retains sodium and water, which makes the heart to work harder. So how do we now stop? I think when you alter it's either you stop this conversion from taking place.
Which one? The angiotensin 1 to angiotensin 2, right?
Yeah. You have to, or you have to stop the angiotensin 2, the ACE inhibitor from converting the angiotensin 1 to angiotensin 2. Yes.
Oh, so we have to convert the enzyme, right?
You have to stop the enzyme from acting.
Ladies and gentlemen, good luck. Jonathan has spoken, and I think it's final. I will not accept any answers again. So let's inhibit the angiotensin converting enzyme. So now when we inhibit it, I want to now test people. I want you also sitting on the fence to now please jump over the fence and come in. When we inhibit this enzyme, what do you think will happen in your own view? Caleb, thank you for the answers. Yes, guys, I want to hear feminine voices.
If we inhibit the ACE, that means the angiotensin 1 cannot convert angiotensin 2.
So we will not get angiotensin 2 into the system.
Yeah.
And what else? What will happen? What does that mean?
And that means that aldosterone cannot be released, thereby retaining sodium and water, which increases the blood pressure.
Kabrofuni and yet
To
thereby
rather release,
thereby not my confused.
it will retain the potassium will be retained, and then sodium and water will leave freely. Will be excreted. If
me Mavis now why thereby no me sad thereby now why wono say national debo say me sister me family fam bi nyabotre family fam nyabotre me ho pa gro me ho na pesa no do unya be ma unya abotre kura sa de de me de nyabotre family kom.
So I was saying that if we stop the process of releasing angiotensin, converting angiotensin 1 to 2, aldosterone will not be released. And if aldosterone is not released, that means sodium and water can be freely taken out of the body.
Okay. And then if sodium is going out, then which one will stay? Because the two of them.
Potassium will now be retained.
So potassium will be retained. Okay.
Yes.
Apart from that, any other person to add to it? Thank you. You've corrected yourself. I like that.
Yes, so we said that the angiotensin 2 is a potent vasoconstrictor.
Okay.
So if we are not having that in the system, it means that the blood vessels will be dilated instead of constricted.
Will be dilated instead of constricted. And what will happen to the blood pressure if the blood vessels are opened?
It will be lowered.
It will be lowered. So we need to use that drug. But if you continue using that drug, what do you think can happen with the potassium thing?
They can increase in dangerous amounts. Hyperkalemia.
So, guys, Caleb, this question is for Caleb. Caleb, do I have the right to say that we have to watch out and monitor potassium levels when a person is on ACE inhibitors?
Yes, we have to.
This question is for Patience. Sister Patience, please, are you still around?
Yes, I'm here.
Do you think that when we use a drug that inhibits the angiotensin converting enzyme, we will achieve a lowered blood pressure all the time?
Yes, we will.
Yes, we will. Okay. Yes, no. Yes, I will. God be my helper. 2 weeks. What do you more? ACE inhibitors. So it's going to help us by preventing the conversion of angiotensin 1 to angiotensin 2. Now, we are going to use it for hypertension. Guys, you agree we can use it in hypertension, right?
Yes, sir.
So, and per yesterday's note, if it's preventing hypertension, then it's definitely going to also prevent the other heart issues, myocardial infarction, heart failure. We know the trick. But it's saying that Mod, I'll let you be the second person to try it. So stand by and wait for the person to say something that is not true. But if the person says something that is true, confirm it. The thing is saying we should avoid it in pregnancy. Now, I want somebody whose name starts with a P. Why do you think we should avoid it in pregnancy? There is no wrong answer to this, please. Mary Adams, do you want to try?
Yeah, because of the because of the cardio protecting, that's why it's avoided in pregnancy.
I don't get it, honey.
Please, from I heard from them, the moment the AC is inhibitor is being given, so let me come again.
Yes, I will let you come again. I actually wanted somebody whose name started with P.O., not A. But message you next time you see you Mary. I will chase you. Anybody whose name with P, come, try your best. Let me go and give you the image. Why do you think we should avoid it in pregnancy? A drug that will inhibit ACE. Why should we avoid it? There's no wrong answer. Even Mary is right.
Yeah, because if the AC inhibitor is stopping the angiotensin 2 from vasoconstriction. Now there will be increase in blood pressure. So when you give it to the pregnant woman, there will be problem.
Why? I don't get it. When we give the ACE inhibitors, the wisdom is that it is going to make sure our blood pressures are low, right? When we inhibit this, it's going to this enzyme will not make sure our blood pressures are high. But when we inhibit it, then the blood pressures will remain low. So why are we not going to give it to a pregnant woman?
Because
More that with Pina Mama Mary Brennan.
Is it that it will cross the placenta and affect the fetus?
Was this patient? Is your name starting with
the
P?
pregnant
Yes.
woman,
Mary, give me just a second to tackle it head on with the lady with the name P. Patient, I don't know my breast.
I'm not too sure, but I was thinking.
Yeah, but I wanted to hear. Yeah. So you are thinking that it will cross the placenta. So maybe it's among those drugs that crosses the placenta.
Yes.
Okay. But if with the understanding of the physiology, even if it crosses the placenta, why are you too worried? Okay,
I know with this the blood pressure will be low, but
okay,
the blood pressure is low.
let me ask Maud what she thinks too.
Okay, come in, Maud.
Yeah, come in.
Say,
yeah.
we said that if we give this ACE inhibitors, okay, we are going to retain potassium in higher doses. So
it can, yeah.
It can, yes. So and we know that these how do you call it? The potassium will cause dangerous arrhythmias or dysrhythmias. That is problems with the heart. And we know this heart is the one that is pumping the blood through the placenta to the baby.
Okay.
So if we have dangerous arrhythmias, it means that it will affect the baby as well. That's the first thing.
Okay.
And also, if we reduce the BP to a certain, say, low levels, it will also cause hypoperfusion to the baby through the placenta. So then I think we have to stay away from it.
If I'm to give you marks, I'll give you 10 over what? In thousands, mommy. 750,000. 10 over 750,000. Any other person to try? Make mass dear. Make farmers in jail. Timotona. Any other person to try?
Asabi.
Yes.
If you said why we cannot give the ACE.
Is your name with P?
Yes, please, Patricia.
Okay,
please.
Go ahead.
Okay. Please, you said why we cannot give ACE to pregnant women.
Yeah.
I mean, okay. So I'm thinking when we give it, there will be vasoconstriction. And if there's vasoconstriction, that means there's going to be...
Hold on. There is a hormone called, not a hormone, there is angiotensin 2, which is a potent vasoconstrictor. When you have ACE inhibitor, when you give ACE inhibitor, will you have this angiotensin 2 coming into the system?
No.
No. So that means there will not be what?
Vasoconstriction.
Okay, so reframe yourself. I want to hear you. Okay.
Okay.
Now, let's not waste my time. Let me save you the hassle a little bit.
Okay.
What do we know of fetuses in the pregnancy? They are developing organs, true or false?
Yes, sir.
Would you like to inhibit an enzyme that is developing in the womb?
No.
If the woman decides to eat chibom, do awisha, asawo, awisha, kong kong, and then take some abochi meat, and then develops blood pressure, must the child also suffer the inhibition of an enzyme because of the mother's illness? The concept will be no.
No.
So probably because it is having a direct effect on a live organism, or let's say an enzyme, we are a little bit careful. So in addition to all that you guys said, including the most important one, which will be the likelihood of increasing potassium levels, causing fatal heart arrhythmias, and then the other ones I can't add, but I would add extreme vasodilations and other electrolyte imbalance. They are a little bit careful of not doing. So guys, my question, will you give ACE inhibitors in pregnancy?
No, sir.
No, sir.
No.
All right. Now, you see, if somebody asks you a side effect of the ACE inhibitor, what will you say?
Increases potassium.
Increases potassium. So when a person is on this drug and is at the same time eating potassium stuff, what will you advise the person?
It should reduce the potassium intake.
Any
And
other
also
person?
monitor potassium.
Okay, potassium levels.
And then
even if the person is using a potassium retaining drugs, right? We know that there's a type of diuretic called potassium sparing diuretic. It means the patient has to be very careful. But guys, let's be honest. In Africa, don't we tell people with hypertension to eat banana?
Yes, and even coconut water.
And coconut water, don't we do that? Are these not really rich in potassium?
Yes,
They
sir.
are.
Yes. So it means that we should stop being doctors whilst we are not doctors. We are killing people. We are giving them heart arrhythmias. Until you say, doc, when I take the drug, it will interest you to know when I take the ACE inhibitors, I rather feel my heart beating more. For all you know, it is the nutrition that is wayward. Okay. Now, when I think of the enzyme, that enzyme that they don't know, me too, I don't know him. It looks like some caterpillar. So the names, just like a caterpillar, would be to me in my eyes. That is how they also call it. They just add the to the names. We have lisinopril, enalapril, ramipril, captopril, quinapril. I mean, just take any name, add pril to it. Make sure what mom is sure. Sister, what pre into pril. That is it. You see, this organism I do here, I don't know what it means to me. So I'm wanting the pril, but that is how the pril sounds to me, visually. Those days when we were in SHS, we used to sing and say pril, 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 so capto pril, 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 and another pril. We were just singing with it without understanding the whole concept. Let's answer a couple of questions. Please answer the chat box quickly. Okay, a couple of people have answered. Well done. Right. Now, let's look at this. Yesterday in the class, there was a lady who said she was new to the class. I went on agreement with her. Does anybody recall that I went on agreement with a lady in the class? Does anybody recall that scenario?
Yeah.
Yes,
You watch when you watch it, you heard it. And then the agreement was that we are not going to harm any hormone or enzyme. Do you remember?
yes, sir.
That was the agreement. But here we are today inhibiting an enzyme. Now, let me tell you something. Those days when medicine was young, we thought that the action of AC, angiotensin converting enzyme, all that it does is it acts on angiotensin 1 and convert it to angiotensin 2. We were wrong. We were wrong. That is not the only function it does. It also breaks down bradykinin. And I'll talk about it. Let me ask you, not ask you, let me tell you about it so that we do not waste time. Bradykinin is one of the substances that is needed as an inflammatory response. So when your body is going to go into inflammation or is having an inflammatory response, bradykinin is also produced. We have leukotriene, we have people even like when you are in Ghana, you can call it bradykinin, right? But I call it bradykinin. It depends on how you want to pronounce it anyway. But it's a mediator of inflammation. Now, when we say something is a mediator, what do you understand by mediator? In your own words, a mediator. When you say something is a mediator,
Intervene.
Yeah.
so can it mean that at a point it can increase you if it needs to do that, and it can also decrease you if it needs to do that, right? That makes you a mediator.
Yes. Yeah.
So a mediator does not do one thing. All right. Now we all know the processes of inflammation. Let me just take it away and ask you guys, what are some of the inflammatory processes when inflammation is going on? What are some of the signs and symptoms, or what is some of the physiological processes that will happen?
There will be warmth to the parts.
There will be warmth to the part. Good.
Reddish. The part will be reddish.
The part will be reddish. What else?
Swollen.
There will be swelling. Hey.
Tenderness.
Tenderness or
Pain.
pain. Oh,
Tenderness.
Charlie, you guys, you kill me too much. So that actually is what happens with inflammation. The place will swell and all that. Now, this is it. So we have now gotten to understand the two work of the the ACE enzyme, angiotensin converting enzyme. We've got to know its work. One, what it does is that, please pay attention as the class go on. If you lose guard, you will lose whatever you've built in the last period. This is where you build on. And don't think you will learn it later. No. Push me back if you have to, because this is a very vital aspect of your test. These questions, they do ask a lot. So we knew that the ACE or the angiotensin converting enzyme would have converted angiotensin 1 to angiotensin 2. Then more recently, we've known that it also inhibits bradykinin. Okay, so with the concept of bradykinin, if let's say an inflammation is going on, I mean, the inflammation can't go on forever. Guys, are you with me?
Yes.
The swelling would go on forever. The pain shouldn't go on forever. The warmth, all that you guys said, the redness, it shouldn't go on forever. There should be a time that it stops. Now, bradykinin is mostly responsible for inflammation of the upper part of the body. Mostly, it works from the chest up. Central actin. It works from the chest up. So if you have an inflammation in any part of your face, after the inflammation processes has gone on for a while, this angiotensin converting enzyme will cut it off. Okay, will cut it off. So if the angiotensin converting enzyme is not there, then bradykinin will keep increasing in the body and it will keep increasing. And whatever inflammation that you have will keep going on. So what we are saying is that if we are inhibiting this enzyme, if we use ACE inhibited, the drugs ending with pril, captopril, enalapril, ramipril, asabipril, any of those prils, when we use them, we will not get the conversion of angiotensin 2, which would have been a potent vasoconstrictor, so the vessels will be dilated. Also, we will not get adrenal gland releasing potassium and then causing sodium and water reabsorption. So in this case, we are rather getting potassium being taken into the system, plenty, and then sodium going out of the system. Okay, and then sodium going out of the system. So if we're using ACE inhibitors, this is what is going to happen on that side. Then on this side too, if we use ACE inhibitor, it means that bradykinin levels will keep going up, because if it was there, if that enzyme was there, it would have inactivated the bradykinin at a point. But because we have inhibit the enzyme, then it means the bradykinin will go on. So it means the inflammation processes will go on for quite a long time. Now, I want to teach you something. When we talk about the side effect, all the side effects we spoke about yesterday will hold. The orthostatic hypotension, the dizziness, the headache, the fatigue, that one you can talk about it. Okay. And then because it's also having to do, the physiology has something to do with renin from the renal system and all those kind of things. I mean, you can have some renal issues, but that is just on a lighter note. Now, this is what is going to typically happen. Bradykinin. Let me ask you guys a question. What will happen to bradykinin if we use ACE inhibitors? Will they keep increasing in the body or they will decrease?
They will increase.
Keep
They will
increase.
increase.
Okay. These bradykinin, they are mostly found around the lung area in the respiratory tree. So when they increase, they will cause irritation of your bronchial trees and your lungs. So what you will do is that because of that irritation, you will try to cough them out. You will be coughing, but you will not bring any production. So it will cause dry cough. So when I ask you, one of the side effects of ACE inhibitors, you say is what?
Dry cough.
I think you know why is it having dry cough? Don't explain plenty. Just mention one word that will cause the dry cough.
Because the
Increase
of the increase of
Bradykinin.
bradykinin.
Please, guys, does it make sense?
Yes.
Yeah.
Yes.
Yes.
Because you know, I just say one tear say right from and what no, and it will make the teaching difficult. But I mean, you're still entitled to say no anyway. Please, do you understand?
Yes, sir.
Yes, please.
Mary, do you understand?
No, sir.
What is causing the dry cough?
Sir, I know the bradykinin. You said when there is increase in the bradykinin,
Okay.
that is causing the dry cough.
But do you have a problem with somewhere in the lecture or you are okay now?
Sir, I'm okay.
You sure?
Yes, sir, I'm okay.
Today, if you call me, I'll pick, okay? Normally, when you call me, I don't pick. I'm sorry.
Okay, sir.
So are you planning to call me again? Hey, this is a my room fan chame ba kokora. Okay, I'll pick when you call today. Okay, I'll try and make time, even though I have some assignments, but I'll try and make time. So there will be dry cough. After the hyperkalemia, you and I agree there will be hyperkalemia. True or false?
True.
True. Okay. So the dry cough and the hyperkalemia is expected. Now, there is another thing that is not expected, and that is something I really want you to put your mind to. I want you to put your mind to. You see, we said bradykinin is responsible for inflammation at which part of the body?
Upper
The
part of the
lungs.
body.
The upper
The
part.
lungs.
So let's say, for example, you are on ACE inhibitors, then you visit Caleb, and Caleb say he wants to use his tongue to pick something small from your lip, what we call kissing. And then he do it, and then some small, tiny, you become, and inflammation starts. It means that because you're on the pril drugs, which is the ACE inhibitors, example like Snoop and another pril, the inflammation process will keep going on and on and on. So we're not possible, no? Okay, so you can see, and this we call it angioedema. Angio is vessels, so it's like there's fluid in your vessels due to the bradykinin thing that we're talking about. So, guys, are you okay?
Yes, sir. Yeah.
Yes,
sir.
Okay. So if I ask you why there will be angioedema, what other word will you tell me? Who is causing that?
The increased
Bradykinin.
The
bradykinin.
bradykinin.
Guys, please don't let them trick us no matter what. No matter what. So instead of, now let's go back to the diagram. Instead of inhibiting the enzyme, what else do you think we could have done? You see, we have this. I want you to concentrate on this part. The enzyme, angiotensin converting enzyme, would have acted on angiotensin 1 and converted to angiotensin 2. What can we do? Said that the enzyme will be there, But we will still not get the convention of angiotensin 2. Yes, anybody should try.
So we can also inhibit the release of the renin.
Oh, that is also another enzyme. It will definitely come with challenges, bro. What we do talk, the mind, eh? We say make we no harm any enzyme in the body. Oh. We can do that. We have a drug for that as well, but it will definitely also produce side effect. But I want us to tackle this one. If you still want to maintain the angiotensin converting enzyme, because when we tackle the renin, it means that the angiotensin converting enzyme may also work there anyway, dear. Yes, it's also another good choice. But what else?
Would have
You
to block the receptor.
receptors.
Yes, that is what I would agree for now. Guy, what you said about the renin one is 100% correct. There's a draft for that. We call them the renin. Okay, renin inhibitors, but we'll talk about them very soon. So, angiotensin 2, the site where the angiotensin converting enzyme, sorry, let me use angiotensin. So, this is what is going to be converted by ACE into angiotensin 2. So, the site where the ACE will work, no, we can block it. We can block the angiotensin receptor site. And when we block it, what will be the name of those drugs?
Angiotensin receptor blockers.
Guys, do you agree?
Yes, we do, sir.
Yes, sir.
Okay, so let's bring our mind to it. It looks like people are tired, but that's all right. I mean, we still have to cover those places. So we have angiotensin 1, and then we've blocked the site where the angiotensin converting enzyme will act on. So what is going to happen in this case is that we are not going to get angiotensin 2. True or false?
True.
But will the enzyme be free and working, doing its other work?
Yes.
Okay, so if we still don't get angiotensin 2, what will still be the issues that we are dealing with? What are we going to achieve if we still don't have angiotensin 2, if you block the receptor site?
Reduce blood pressure.
We will still get the BP going down.
BP going down. Yeah.
What else?
They will stop the edema,
Sodium
the
and water
angioedema thing.
retention.
Yes, the angioedema will then come into the scene. What else?
There will be no
There
dry
will be
cough.
no accumulation.
There will be no dry cough. What else?
Then bradykinin will be reduced.
There wouldn't be hyperkalemia.
Oh, Mary, I love your answer, guys. Let me listen to Sister Mary. There wouldn't be hyperkalemia, and I agree.
Yeah.
But in fact, there would be, Sister Mary.
Yeah.
Yes. The truth is that the angiotensin 2 will stimulate aldosterone, and aldosterone will cause sodium and water retention. So if angiotensin 2 is not there, it means that sodium and water will be released and we'll still get it. So when I ask you one of the side effects of angiotensin receptor blockers, you can still talk about the hyperkalemia. Guys, are you with me?
Yes.
Yeah.
Yes, and you still not give any of these renins, angiotensin, any drug in the angiotensin converting enzyme groups, whether angiotensin receptor, you will not give them in pregnancy. Guys, are you with me?
Yes.
So they are inhibited in pregnancy. So we will still get the hyperkalemia, unfortunately, Sister Mary. But I love the approach. That was a very good try. Yeah. Now, this was
question.
what. Yes, come in, my dear.
Okay, so if I understand what you just said, so that means with this angiotensin receptor blockers, we are blocking everything down here from angiotensin 1 all the way to the bradykinin, right? We're blocking all that side.
No, this one wouldn't even come into the scene. So let's divide the two here. So this is one process that the angiotensin converting enzyme dies. And this is another process that the angiotensin converting enzyme does. It has two functions. One function is that it converts angiotensin 1 to angiotensin 2. Another function that it does is that when you are having inflammation, it stops the process, okay? So if you are not inhibiting this enzyme and you allow it to roam around, this number 2 function that it does by inhibiting inflammation will still go on, right? Because the enzyme has not been inhibited. But if you allow it, whilst it tries to work on this one, because you've not inhibited it, it will come all right to trying to work on this one, but you have blocked this site.
So he wouldn't be able to come anymore.
He will come, but he wouldn't work.
Oh, okay, okay.
Yes, he wouldn't get the surface area to attach itself to do the conversion.
That makes sense. Thank you.
You're welcome, my dear. So, any other guys? Okay, so that will be for that. And can anybody give me an example of an ACE inhibitor? Let's know ACE inhibitor. A drug called an ACE inhibitor. Anybody?
Lisinopril.
Lisinopril.
Enalapril.
Captopril.
All the
Okay.
purple, all the
All the
purple.
pril. Okay. So
Anapro.
when a patient is on any of these ACE inhibitors and is having dry cough or angioedema, what will you do?
You stop the medication.
Yes, then you can give the ARBs.
The angiotensin receptor blockers, they will also perform the same thing, but they will not get the usual dry cough and then the angioedema, right?
Yes, sir.
So that one is prevented. Now, ever since this drug was discovered, doctors no more want to now give you the lisinopril or whatever is inhibitors before you now complain. So they were just going ahead to straightly buy the angiotensin receptor blockers. So the ACE inhibitors look at this angiotensin receptor blockers and say, "Mo yabonsam, for you guys are Satan," and that became their name: losartan, valsartan, tamisartan, and sartan. Guys, do you get it?
Asabi. Asabi. It's crazy.
So that was the whole idea.
Best market.
I almost say marketing.
Receptor blockers are Satan.
Say again. In fact, there is this. We call this one. I'm trying to recall. I think it's called structure activity relationship. I think to angiotensin. Structure activity relationship to angiotensin. That is pharmacology. They have their nomenclature and how they name them, but we don't have the luxury of time to learn that thing. Okay. And so just as we did for the others, you avoid in pregnancy. Even if the person's kidney is not working well, you stop it. Now, for lisinopril, lest I don't tell you, let's look at how the lisinopril was working. Did you see that all this thing that was going on was kind of the renal action, right?
Yes.
Yes, the renal and adrenal. So if you are inhibiting any of these processes, like you are giving some vacation to the renal system, kakra. So when people have diabetes that continually their sugars, glucose levels are high and they are passing through the kidneys. In fact, the kidney is also responsible for bringing your blood pressures low and just bringing your blood pressures high. It's a lot of job. So when you give the ACE inhibitors or even sometimes the angiotensin receptor blockers, it's like you give some holidays small to the kidneys. So when a patient is having diabetes, a doctor may give the patient, please write it somewhere, lisinopril, a low dose. They call it renal protection, just to protect the kidneys. Once a while, normal kidney call vacation kakra. Once a while, gives vacation to the kidneys. That is the trick. Okay, so keep that in mind. I don't know where you meet that question, but I know it's on one of my slides. I think on the antibiotics, it will come in handy. Okay, so if a person's renal system is having issues, I mean, you don't even give some of these medications. Of course, for the side effect, hyperkalemia will still be there, but we don't get the dry cough and the angioedema. Let's answer this question quickly. Remember, you are a nurse. So. Okay, people are answering. Let me take a look at the answers. Okay. People are saying the answer is 2. Do you also agree the answer is 2?
Yes.
I don't think
No,
so.
sir. C. It's C.
But you answered 2.
3.
Is
Sir,
2
yes, I
different from
just.
C?
It's C. I just looked.
Who are you to advise patient to stop taking the medication immediately?
Yeah, I see. That is not life-threatening.
Yes, so you document it. So on your NCLEX, they will ask you which of these is an expected finding. Like, guys, let me ask you, between dry cough and angioedema, which one is an expected finding?
Dry cough.
Dry cough.
But can we say they are all side effect, right?
Yes.
But which one will be what we call an adverse side effect?
Angioedema.
So now, guys, you see the differences of how the NCLEX will question you.
Yes, sir.
So with this one, yes, come in, my dear.
So let's say it was an angioedema instead of the dry cough. Are we still documenting?
Yes, you will still inform the healthcare provider. They have the prescription authority.
Okay.
So you document it. You are trying to place what we call it a good catch. You are displaying a good catch, letting the doctor know that these symptoms have started happening. And when the nurse kind of know that with this kind of drugs, even though it's the adverse effect, you still don't really stop it outright. You inform the doctor. Okay. But if it was the adverse effect that was happening and I am the one meeting the question, I'll be tempted to pick it as an answer that stop it, right? But that wouldn't be me advising the patient to stop taking the drug. I will rather make the sentence sound like hold the morning dose and inform the doctor. Right?
Yeah, that one sounds a bit more correct.
Yes, because in medicine, they have somebody is talking outside and still in class, so I don't know the person though, but please can you watch it? But we have ethical principles guiding our ethical dilemmas in practice. The other time they said that there was a child who had only one kidney function and was dying, and there was an adult who had no kidney. Should we convince the child to give the kidney to the adult? You see, those are ethical decisions you go through based on what? Because even if you present it to the child, you in a way you are going to inform. You do, I mean, it's a whole lot. So if there is angioedema, is the angioedema going to kill the patient as compared to his or her high blood pressure? Right? It is the doctor to determine that. So you document the symptom. If you are given a morning dose, you ask the doctor whether you should hold it. You inform the doctor about it. It's dicey, but I mean, the NCLEX will be fair to us. They will give us one that we can easily identify. I pray so. Okay. All right. So the answer was C. Lots of people have changed the answer.
Yes.
Yeah, it's okay. It's good if you change the answer. We are all learning the hard way. Okay. Answer. Let's be honest. Please be honest with me. Somebody can get onto the NCLEX, see this question and say the questions are easy. Can the person say that?
Yes, sir.
But be honest with me. This question, is it easy?
It's not easy.
It's not easy as you see it too. And you
gone
are don't worry, it's not easy. No, I kind of why you don't say no. Yeah, don't follow them. There is a lot more to it. The people asking the question, they know what they are asking. Okay, let's try this if you really understand the question. Prazolam is an anxiety medication. If I give you the guaifenesin, you get the trick. I won't tell you, but it's a cough for dry cough.
Prazolam.
Sometimes, if you don't know, you are free because your knowledge of guaifenesin will even tempt you to pick it as an answer. To him, more is given, more is expected.
Exactly.
So the concept is that if you know the tricks, when the question comes, last time when you guys were solving the question bank, when we were using the last, I observed something. It's like you guys were able to feel like what the questions wanted to ask you, but it was just difficult for you to pick the answers. When you say where and for you to share free, but that's it. Sometimes the answers are just difficult to pick, but you were right on what the people were testing you on.
That's our problem.
Yes, and that to me, it's a very good strength. Just to know, say, oh, I know this question is about testing the mechanism of action of these ACE inhibitors, but the concept is it going to be like in the case of Asabi, he has forgotten whether the sartans are the ARBs or the lisinoprils are the ARBs. And no sound the very now if you but wouldn't says when a question, and that is my duty to let you know what the question truly tries to seek in certain situations, even if you don't know the condition. Well done for the answers anyway. I love the answers. But there is another drug called the angiotensin receptor neprilysin inhibitors, ARNIs, which will be used in heart failure. But guys, let us spare ourselves of that for now. Okay, I will spare you that one for now. Let's answer this question. So say there is a question, but you who have been in class, you know what the question is answering. Patients, don't you think you know exactly what the question wants to ask, right?
Yes.
But
Yes.
to the one answering the questions, they are not the book knowledge. They are using book knowledge and some tricks to answer. But you know exactly what the question is asking. Is it true that antihypertensive will give orthostatic hypotension?
Yes, sir.
And you know this is what that one is asking, true or false?
Yes, sir.
Yes.
True.
Orthostatic hypotension.
Yes. And I don't know how they said the question. So here, the way they said the question is, if you, after taking this class, were to even set the question, you agree with them that they have every right to bring these possible answers. Because a bang is close to the whole thing we've learned. Okay. So one thing, what is the question asking for?
Angioedema.
Angioedema. The whole thing is about angioedema. Okay. Guys, any question? Now we are here. Today we will end with the calcium channel blockers. We are left with 20 minutes to finish, and I think we can use 20 minutes for that, even less. Okay. Now, for the central, any questions on all that we've studied from yesterday to now? ACE inhibitors, beta blockers, and I think we've done angiotensin converting enzyme inhibitors, angiotensin receptor blockers. Alpha blockers. Yes, we've learned like joke. We are on our way. This is pharmacology, the usual sleeping subject in the afternoon. And here you are, widely awake. Please, any question? You know what pains me?
I even feel like it's pharmacology. You're making it interesting.
Aww. Say, you've promised to take good care of me. Sister Pace, you said you'd take good care of me.
Oh, sure, I will.
In
due time.
Just say, offend me with money. Hey! And I'm rather me by say. Okay, and I remember online. Okay, so the centrally acting one, when we talk of the central nervous system, we are looking at the brain, the spinal cord, and in fact, central here in the body most of times refer to the chest upwards. You know, when you take a central market, it's where the major marketing activities go on. True or false?
True.
True. In the military, they have a central command where command is situated heavily. So the central one is acting straight on the brain. And in fact, when we learn about alpha receptors, do you guys recall that I said we have the alpha 2 that is mostly working in the sympathetic nervous system activity kind of thing, right?
Yes, Asabi.
In actual fact, if we were supposed to talk about centrally acting agents, we would have called them alpha 2 receptor agonist. What is the difference between agonist and antagonist, or agonist and antagonist?
So the agonist is acting same way as, let's say, the enzyme, and then the agonist will act against the enzyme.
God bless you. So the agonist is mimicking the natural process or working just as the natural phenomenon in the body, right?
Yes.
And the agonist is going against a natural phenomenon or natural activity in the body. So when I say alpha 2 receptor agonist, what does that mean? Is that the blocker?
No.
It means it's helping its activity.
Yeah.
Okay. So when we give you these drugs, they just go into the brain and just tell the body, hey, Charlie, I beg, do something, perform magic, bring the BP down. So this one wouldn't go and harm any enzyme. That no, just go straight to a receptor in the brain and then it works. An example is metaldopa. And then the popular one, chlorobenzidine, called clonidine. It was my first central acting agent that I learned, even before metaldopa. And then the new one, which is Benz. Then once upon a time when I was teaching, one of my students gave me a very nice thing to recall. Because I asked them a question. I told them that when you go to a program in Ghana or Nigeria, who will be the person you will hear more or see more? And the answer is who?
The MC.
The MC. He's the central man
of attraction.
Yes. Master of ceremony. Now the girl said MC drives Ghana Benz. MC knew Ghana Benz. So the MC was the metal, dopa, and clonidine. Because the MC is the central man you see in the whole activity, is the center of the activity, metal, dopa, and clonidine. And then the Ghana Benz is just for guana Benz, just so you know. Then we have guanfacine or guanfacine. It's different from the cough syrup that you were seeing with the SIN. Be careful here. So I'm just giving you this three. MC Ghana Benz. Yeah. So it is effective. When we were doing the ACE inhibitors, a question to you, can you give ARBs? Listen, no, ARBs in pregnancy. Can you give that drug in pregnancy?
No, sir.
Oh.
What about ACE inhibitors?
No, sir.
Which drug would you like to give in pregnancy? Yankwe?
I think this one.
This one, the central acting.
Which one?
Guana Benz, methyl dopa, clonidine.
Guana Benz.
Guana
Benz. Now, ladies and gentlemen, with the clonidine, when a person is having withdrawal symptoms, they can also use it. Those people who work in PACES, I've forgotten what PACES is. More do you search for it for us. But it has got to do with addicts, drug programs, okay? PACES. It's an agency in the US that does that. And then we have Alcohol Anonymous, opioid use. Yes, you wanted to say something?
No, please.
Okay, so PACES, when a patient has done drugs and then they are weaning the person off, or when the patient is exhibiting those high signs, since you know that drugs used in hypertension calms the patient, and they are using that principle to give the patient clonidine. And I think if my memory serves me well, it's 0.1. Sometimes the highest will be 0.2. Now, guys, don't worry much about the doses, okay? NCLEX does not put that burden on you. But when you come by God's grace and you start working as a nurse, please, for each particular drug that you give, just watch the dose a little bit. When I started my nurse practitioner school, I realized it's a bit helpful. Okay, it gives you an idea of the type of doses to quite expect. Okay, and most of you, when you come, by the time you come, I would have completed some schools. I mean, I will try my best to guide you. This relationship may last for long. Some of you have even pledged not to read anything on the billboard after these exams. I know, I said same too. But here am I, you. You go far. The fact that I know you and you know me, if you are a big man, I will enjoy. If you're a big woman, I will enjoy. I will be proud. I will mention your name. So if I have any help, why don't I give it to you? You see, when my son, those days, he says, oh, me or Fabi, oh, my mother's friend, my mother knows somebody who I know. And we are now building, my mother's friend now, we need enemy know. The father's friend, no, on me. Timmy, so me man, father's friend, and no. Now, Mumba, the catch him say, yes, I'll cause him. Mr. Oye, Nebo, Mamma, why? Yeah. Okay. All right. So that is fine. So this one, whether asthmatics, heart failure, all the other drugs we've spoken about, they are contraindicators. They can take some of these drugs. Okay. And those who are new to my class, you are welcome. And before we go to calcium channel blockers to end the class, I just also want you to know that whilst I teach, I discuss life in the US alongside once a while, just so you know what is preparing you. You see, it's a concept of faith where a village went to pray for water. They went for rain because there have been drought. It has not rained for a very long time. Whilst they went there, one of the kids came with an umbrella. You see how faith works? He knew that that prayer is going to wet that same day now, and then he doesn't want to get wet. So he brought an umbrella. Yes, that is how I'm treating you guys. I see these exams as done already in my sight. Because for me, I was told, I don't believe in spirituality, but I was told that with me, lots of people will move to America. It sounded like a joke to me. So if you are here, it means you are part of what they said.
Amen.
That is how confident I want you to feel. It's not a mistake. Ask Maud and the other people who know. I came here. I even went to the UK, blah, blah, blah. Still, I'm here. I will tell you those stories later. But I was sacked from work. For nothing. By 5 months, I was home. I was teaching people, smiling, having fun. Begging me, me call back. Because God will not send you to the farm, show you yam, knowing so well that you don't have a cutlass to take the yam, but He has showed you yam. I'm telling you, by the end of the day, you don't even have intentions. And so,
Amen. Amen.
Yes, that's what I'm saying. So this is just to motivate you. There is a divine hand, and this divine hand does not matter whether you pour libation, you are it doesn't care. Crowd. Peter is the one saying that God is no respecter of persons. In every nation, if you understand that there is a creator, you are good to go. He doesn't care whether you're a Muslim or not. It took Peter a very long time to understand that. So yes, please, when you come, have that confidence. I'm with you. I've helped lots of Muslims. There was a guy, I watched his status. He had shook hands with our national imam. And I said, Bonsu Charlie, no, he's a soldier. Were you able to go to the nursing school, Sam? Because if I didn't even allow him to talk, because if you have not, please do. With this man that you shook his hands, it's elevation. I see you passing in class. So just go to the nursing school. Do 3 years of study. I say, oh, Wasabi, don't worry, I'm a nurse already. I said, come and join my class. I won't take you a penny. I will teach you for free. Seydu is a nurse now. And he wrote a very long thank you. Yes. He wrote a very long thank you. It's part of his testimony. It's part of his testimony when he went to shake hands with that thing. Okay. All right. So we are moving from the MC drives Ghana Benz, and then we are going to calcium channel blockers. Calcium channel blockers. Let me teach you another secret that I do. Most of the people that I tell them to chat me privately before they write, all that I tell them to do is to donate. It's a principle of giving. After the class, I will share that story with you after the class so that those who can stay will stay, but those who need to go and do something else can do it. So let me use the next 20 minutes to finish the calcium channel blockers, and then we go to that. When I ask you about calcium channel blockers, you can rightfully tell me they are the drug ending with dipping. Take any Ghanaian home name and add dipping. So if Philo is there, it becomes what?
Go dipping.
What about Nemo? If Nemo is in the house? So, it just take a Ghanaian house name, add dipping, and we are good to go. Fine, but that is not it. Anybody would have taught that. I wouldn't take you $50 for just telling you something you know. Before muscles contract, there is an influx of calcium. Before any muscle will contract, calcium will enter. Is the heart having a muscle?
Yes, it does.
What is the name of the heart muscle?
Myocardia.
Does it contract?
Yes, it does.
Does that mean that before it contracts, there is influx of calcium?
Yes, sir.
If it is contracting too much and too fast, so that it's increasing the pressure, then what do?
We'd have to reduce it.
You have to reduce it. And what do you think? If it is calcium that is entering,
you have to block the entry of calcium.
I love how you said it. You see, Maud is trying to move me with what I'm teaching. She knows she could have said you have to block calcium channels, but then she realized I've not introduced the term channel. So she's taking it from the from the simplest phrase with the one following the class. You just have to block the calcium. That's all. And then Asabi will now come back and say, okay, calcium have channels. And so let's block the calcium channel. Even in a biochemistry class, I'll say the ion-gated calcium channels. You could deep. The 20 millivolts one why the 2 volts be able to show if when you child. But we just block the calcium channels and there's no contraction. And we are fine. In fact, I yesterday said it's one of the golden standard medications. It does everything you can think of. On your NCLEX, you will hear words like inotropic, chronotropic, dromotropic. Inotrop has got to do with the force of contraction or the strength of the heartbeat. The chrono has got to do with the rate, and then dromotropic is conductivity. Let's take dromotropic out. Draw more A, Jehovah, draw more A. That one is a feeling, it's electric. So that one you can easily recall the drummer. In case you use drummers, drummer song. That one is electric, so it's about conductivity. But then the chronotropic, when we talk something about chronological, it is with time. And I can't think of anything with time than the heart rate, because rate deals with time. So for chrono, I really get the rate, even with the spelling of the R in the CHR. Then the inotrope. The NCLEX is not going to ask you to define these terms. But why am I bringing it? So that it will not be new to you. What calcium channel blockers are doing is that it is acting as a negative inotrope, a negative chronotrope, and a negative dromotropic as well. Meaning it will decrease the force of contraction, it will decrease the heart rate, and it will even decrease your contractility or conductivity. So calcium channels, that's what makes it a golden standard. Now, in case you are wondering if there could be a drug that will be negative this, positive that, yes, there is. And I'll teach you when I'm doing drug toxicity, when I teach you about this drug with a narrow therapeutic index. It causes a toxicity we call digitalis toxicity. Now, the treatment of that toxicity, we use Digibind. What drug is that? Solve the puzzle.
Digoxin.
Okay, all right. So with digoxin, for example, when you're going to give digoxin, this is just outside the studio. I think you check the heart rate. Do you agree?
Yes.
Why do you think you check the heart rate? Because it's what?
It will further reduce the heart rate.
So it will act as a negative chronotropic. But it will still also increase the force of contraction. Then it will be what? Positive inotropic. So those in the ICUs doing critical care nursing, they play with some of these words. And me, I can't do it. That's why I didn't go there. Yeah. So, I mean, but don't worry about yours. Most of the cardiac drugs that we are going to talk about, they will act by bringing all these things down. So in effect, it will be anti-hypertensive, anti-angina, anti-arrhythmia, whatever. Calcium channel blockers will be everything. So now with the side effect, there is this serious strange headache. It's so real, and it comes when the vessels dilate. Because we learned yesterday that the muscles, what are mostly found in the muscles? What can we find in the muscles?
Calcium.
I know calcium, but I'm talking about a structure.
Endocrine.
Look at the smooth muscle with alpha receptors. What I found? Simple answers.
Blood vessels.
Blood vessels is what I'm looking for. So if the muscles are contracting, it means the blood vessels are contracting. But if you prevent the contraction of the muscle, then it means the blood vessels will remain what?
Relax.
Dilated,
Relaxed,
relax. I like
and
that term,
dilated.
relax. Good. And so with that said, when it's dilated and relaxed in the head and the brain, it can sometimes stimulate some headache. It can even cause dizziness when you take it, opens like that, it can cause dizziness. And it can also bring your blood pressure down, which is the hypertension bit, and it can decrease your heart rate, which is bradycardia. Now, in terms of muscles, do we also have abdominal muscles?
Yes, sir.
Yeah.
Please, when you go to the bathroom and then you want to deliver packages from FedEx, do you utilize those abdominal muscles?
Yes, sir.
Yes.
You have to contract them, right?
Squeeze
But
Yes.
you are taking a drug that relaxes muscles. So in that case, it can cause constipation, true or false?
True.
Yes, sir. True.
Uh-huh. And then also, now that the vessels are relaxed, don't you think fluid can be accumulated by gravity downwards? Yes,
Yes.
it can. So in some adverse situations, we can have edema of the feet because the vessels no more be the vessels are open and things are coming down. Somebody called Auntie Gladys sent me something. That means okay. Now we are to avoid grapefruit. In fact, I don't want to talk about this. We have an enzyme in the liver called cytochrome CYP3. Hey, me. CYP3A4. Okay, those you don't need to memorize those names, but the concept is avoid grapefruit. Is it easier to do that?
Yes, sir.
Yeah.
In the Christian Bible, they were going to stone a man for saying that your sins are forgiven. But I literally took my time to examine those tests. He didn't say, I have forgiven you your sins. He said, your sins are forgiven. And when I look at that words clearly, even a priest in the olden Jewish temple could have said that. Because when you bring whatever needs for atonement of sin, they can say, your sacrifice have been taken, your sins have been forgiven, son. They can say that. So what is easier to say? Avoid grapefruit. I don't want to go into the deep why it will cause any issue at all, but the concept is that it has interactions with the liver enzyme. Have you heard of first pass before?
Yes.
Yes, sir.
When you take any drug orally, after digestion, it has to pass through the liver, right? For detoxification and
Yes.
what you call it the first pass. It's as simple as that. Now, there are some of these calcium channel blockers that can worsen heart failure symptoms. Now, do you know what we call a paradox? It's like something that is true but untrue at the same time when you say it. Don't listen to me. Don't listen to me. If you don't listen to me, it means you didn't listen to me.
Yes.
No, if you don't listen to me, it means you listen to me.
Uh-huh.
Look at it carefully. That is what a paradox is. A paradox. It's a figure of speech. Now, in the treatment of heart failure, a difficult question for medical students. I saw it when I was in school. One medical student discussed with me. He said when they're using beta blockers in the treatment of heart failure, the heart is failing. So you want it to beat and then transmit blood or circulate blood into the whole system. Meanwhile, this same, you don't want it to contract heavily because it is failing and has no strength. And it is kind of an ambivalent feeling. Do you know ambivalent? In psychiatry, ambivalence. You love something and you hate that thing at the same time. Yeah. So that is it. It can cause edema in the feet and ankles because of the gravitational pull when the vessels are open. Avoid grapefruit, and then some of them will be avoided, but you don't have to kill yourself. I will teach you what those specific ones are. The dihydropyridines. I will teach you the names of them and I will let you know easily. Now, let's go to an example of them. Remember, I said you take any Ghanaian name, you add a dip into it, and you have a calcium channel blocker. Those are the dihydropyridines, okay? Dihydropyridines. The amlodipine, the fidipine, philo. Nobody on the NCLEX is going to ask you what is a dihydropyridine or not. But there is a new type that I'm going to give you, and this is the type the NCLEX even wants to ask because he knows everybody coming from Ghana know about philo and can easily predict philodipine. So the new ones, I normally question people, those in Ghana, when you buy a new car, what type of number plate do they give you?
DV.
DV. Now, Patricia, please, are you here?
Yes, please.
When people want to go and get their driving license, no, Patricia, where are you? Which country are you?
Please, I'm in Ghana.
Is there any Patricia or patients here in the US?
That's me.
That is you. If somebody wants to get a driving license, where do they normally go?
The motor vehicle.
DVMB.
Yeah.
They can say DMV.
DMV, yes.
DMV. That's what they say. MV. And here they have a car for. So these are new drugs. And they give you DV plate, or you go to the DMV if you are new. So I'm also going to give you new drugs, just as we have the DV. Diltiazem and then verapamil. Diltiazem. I used to call it diltiazem, but I mean, however you pronounce it. Diltiazem and then verapamil. These are the new type of calcium channel blockers I'm giving you. They are the non-dihydropyridines. These are the charlatans responsible for the fall of the Ghana cedi and the rise of the Nigerian naira. So diltiazem and verapamil, they are also the types that can be given as an infusion. Are you with me? The rest that you knew, they'll be given as oral drugs. This diltiazem and verapamil, example of the diltiazem, the treatment name is the cardizem drip. When you come to the hospital in cardiology, they will give you cardizem drip. What's so bad? Half a year, titrate. What's a impact of titrate is interesting. Haven't you heard of titration? Charlie, it's not easy. They say titrate it and let's see. Then, hey, yes, diltiazem, verapamil. These two drugs I'll leave you. I put before you life and death, but I'll make you choose life. Diltiazem and verapamil. Please, these two, hold them serious. They are calcium channel blockers. Okay. While some of them, the calcium channel blockers, some of them will work on smooth muscles, others on cardiac muscles. It's not your problem. Leave those aspects out. I sometimes bring some of these slides just to prove. Sometimes I get people who excuse me too learned. And then they also want to try to prove to you that they are learned. But I still, in return, give them something new than what they knew. I try. Okay, let's answer this question before we close. Bintu me to nka wa hyɛ na wopɛ sɛ ɔka biribi kyerɛ me aka kyerɛ me wae. Bintu Olu Wakati Bush. Ee. Man, say take you 2 minutes to answer this question. Oh. What is your question? Yeah. Okay, let's try this. Me pacho ma honye hakakra wa ni nyina ka adesua no ho so that we can close. Badam pam pam. Shadam pam pam. Badam pam pam. Badam pam pam pam. Badam pam pam. Badam pam pam. O kasa me ho. Wonderful, wonderful is the Lord. Mm, 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 mm.
into Oluwakati bush.
Bintu Ede Bintu Bintu Oluwakati bush. And to Bintu ya me told them now to Anna, how do you feel?
I feel good though.
Bintu Oluwakati bush. Hey, my finger na praises who. Don't do kunka don't tum that. Kunkru. Da Jesus. But I will say, yeah, Adam for. Yeah, that's how more Jumino will peja when you peja first line. I want to be oh. Let's go. Yay. Now I said, what did you know? Massa, Utu see this I cannot debeko. I'm telling you, what the betum. Oh, yeah. Last me ko cycle for Rudiama, me lorry fair crash and come go home come jawa sorry. Oh, Chalikan Edo. All right there. Aha no omubo na boys ne bobo course akese ntine ma honhom ne ma. Okay, let's look at the answers together. The medication works by relaxing my arteries. What other word can you use for artery?
Blood vessel.
Vessel. Is it true that this medication works by relaxing your blood vessels?
Yes, sir.
It's an artery and a vessel.
Yes.
So you see that people will find problem with the arteries, but when they put vessel, it makes sense. Okay, that is logical reason. I will choose it. A common side effect of this medication is dry cough. What do you think?
No, sir. That's the prils, the ACE.
This question was stolen from boot camp, but as if they were here when we were studying. This drug may cause some swelling in my ankles and feet. What do you think?
Yes, sir.
I should take this medication immediately I have chest pain. Are you sure about that?
No.
Not too sure. Maybe they can give, but we are not sure, right?
Yes, sir.
Because we don't know the type of chest pain. So, and then those who are new to my class, please, the old people, what should we be careful about when we are doing select all that apply question? Please advise us.
Select what you are 100% sure of and leave the rest that you are not
skeptical about. Yeah.
Otherwise, what will happen?
You
lose marks.
Oh, I never knew. So when I get it wrong, they deduct marks.
Yes.
Then can I even choose just one answer if I think that is what is okay?
Sure.
Yes. One is better than none.
Okay, so you would actually advise, even if it is one that I'm sure, I just take that one with confidence and leave, right?
Yes. Yes, sir.
Thank you so much. I appreciate you. Bintu, I will be sure to swallow my pill whole without chewing or crushing it. What do you think?
Yes, sir.
Extended
release.
Oh, yesterday we said that when it is extended release, you swallow them whole. Hey, Chala, you guys have retentive memory. I should avoid drinking grape juice when taking this medication. Is that true?
Yes.
So which one weren't the answer? I think 2 and 4 are those that we didn't pick. Let's see what the book have to offer. Of course, 2 and 4. Guys, I appreciate you all. We are ending here, and then we're going to continue tomorrow. Any questions, guys? Okay.
Thank you very much, Asabi, for your time and the knowledge impacted. We are so much grateful. Thank you.
Pass it. Sister, we'll pass and you're grateful as a new. Miss a war pass and the end of the question be a mammy. I should have actually cancer. I must stop recording and I'm